different types of TB. When I talk different types of TB, I mean TB does not only affect the lungs, but it can also affect other parts of the body. For instance, when you talk of pulmonary TB, it is a TB affecting only the lungs. Extrapulmonary TB, it can affect the lymph nodes. TB, it is known as adenitis. It can affect the pleura, it can affect the bone. When it affects the bones, it is known as spot disease. It can affect the meninges, which is TB meninges. It can affect the GUT, it can affect the abdomen, it can affect the spine. Now, based on the status of the patient, latent TB. When we say the patient is in latent TB, it means that the patient is not presenting with any clinical features, and hence the patient is non-infectious. But when we say the patient is having active TB, it means that the patient is symptomatic, having a cough and so on. Hence, the patient is very infectious. Now, based on the drug resistance, we can say multiple drug resistance TB. Multiple drug resistance TB, it is resistant towards the two drugs, that is isoniazid and rifampicin. Now, how will you treat pulmonary TB and how will you treat extrapulmonary TB? First, treating pulmonary TB, it takes a duration of 6 months. One, you do the intensive phase for 2 months, and then you do 4 months of the continuation phase. Now, when you are in the intensive phase, you do the 4 regimen of the drugs, I think, and for the 4 months, you drop the 2, that is, you drop the parazinamide and ethambutol, you continue with rifampicin and isoniazid. Now, when you are treating extrapulmonary TB, you don't treat for 6 months, you treat for 12 months. But you do the intensive phase just like the pulmonary TB. You do for 2 months intensive phase of the same regimen of the drugs, and when you come to the continuation phase, you do 10 months. And just the same, you drop the 2 drugs, that is parazinamide and ethambutol. You continue with rifampicin and isoniazid. Now, when we say multiple drug resistance, that means that the patient is resistant towards the rifampicin and isoniazid. So how are you supposed to treat? You treat majorly with the fluoroquinolones, and you will give also injectable like amikacin, and here you will have to treat the patient for a duration of 18 to 24 months.